parents are being urged to take certain steps to reduce the spread of winter illnesses, as children return to school for the spring term. With the continuing increase of seasonal ailments including COVID-19, norovirus and E. coli, the UK Health Security Agency, UKSA, is reminding mums and dads of simple things they can do to curb the rise of viruses spreading and keep kids healthy. Students coming back to their studies this week are likely to come into contact with viruses and bugs and risk bringing them home, with young children also at risk as they return to preschool. As such, the government body wants to minimize the impact of illness as schools head back and parents return to work. Dr. Catherine Falconer, Deputy Director Health Equity and Inclusion Health at UKSA, said, "The winter period can see an increase in some of the common seasonal viruses which disrupt children's education and cause more serious illnesses. As children head back to school, there are steps parents and families can take to keep a household healthy this January whilst also preventing infections from spreading when children are poorly. By following this guidance, parents are also protecting the wider community. From instilling good hygiene habits, to ensuring children and teens are up to date on their vaccinations and knowing when to keep them out of school, here are 5 things UKSA is advising parents to do to protect their kids from winter illnesses. 1. Get vaccinated. Vaccination offers the best protection against flu and is given as a quick and painless nasal spray for children. However, vaccine uptake amongst preschool children is one of the lowest, despite the illness being more serious for this ages group in some cases. Children eligible for the flu vaccine include, children aged 2 to 3 years old on 31st of August in 2023, all primary school-aged children, reception to Year 6, secondary school-aged children, Year 7 to Year 11, children aged 6 months and older with long-term health conditions similar to the flu vaccine. There has been a drop in uptake of routine childhood immunizations, which protect children against diseases such as measles, mumps, rubella, diphtheria and polio. You can take a look at the childhood vaccination schedule to make sure your child is up to date with all their vaccinations. 2. Teach good hygiene habits. Encouraging good hand-washing habits is one of the most effective ways to stop the spread. Regularly wash hands in soap and warm water for 20 seconds or use hand sanitizer when convenient. Using a tissue to catch coughs and sneezes, binning it and then washing hands will help prevent infection from spreading. UKSA has published debug resources for all ages can help you to explain and discuss hygiene habits, and why they are important, to your child or teenager. Join the Daily Record WhatsApp community. Get the latest news sent straight to your messages by joining our WhatsApp community today. You'll receive daily updates on breaking news as well as the top headlines across Scotland. No one will be able to see who is signed up and no one can send messages except the Daily Record team. All you have to do is click here if you're on mobile, select Join Community and you're in. If you're on a desktop, simply scan the QR code above with your phone and click Join Community. We also treat our community members to special offers, promotions, and adverts from us and our partners. If you don't like our community, you can check out anytime you like. To leave our community, click on the name at the top of your screen and choose Exit Group. If you're curious, you can read our privacy notice. 3. Stopping the spread of stomach bugs. Along with rising cases of norovirus, UKSA has also been seeing higher levels of other gastrointestinal infections, such as Shiga toxin-producing E. coli. If you or your child have diarrhea and vomiting, washing your hands with soap and warm water and using bleach-based products to clean surfaces will help stop infections from spreading. Don't prepare food for others if you have symptoms or for 48 hours after symptoms stop. If you are unwell, you should avoid visiting people in hospitals and care homes to avoid passing on the infection to those more vulnerable in these settings. Do not return to work, school or nursery until 48 hours after your symptoms have stopped. 4. Spot the signs of when to keep your child at home. Children are encouraged to stay in education or childcare with symptoms such as a runny nose, sore throat or slight cough as long as they don't have a high temperature. However, they should stay home from school or nursery if they're displaying the following symptoms. If your child has a fever and is unwell, they should stay home from school or nursery until the fever has passed and they are well enough to attend. If your child has diarrhea and/or vomiting, they should stay off school or nursery for at least 48 hours after their symptoms clear up. This will help stop the spread of stomach bugs. At this time of year, other types of illnesses that circulate are scarlet fever and chicken pox, as cases usually peak in late winter and early spring. Symptoms of scarlet fever include sore throat, fever, swollen neck glands, a bumpy rash on the tummy, flushed cheeks and strawberry tongue. If you suspect your child has scarlet fever, contact your local GP, and if diagnosed, stay away from nursery or school for 24 hours after the first dose of antibiotics. Chickenpox is highly contagious, with the most common symptom being an itchy, spotty rash. If your child has chickenpox, keep them off school until all the spots have crusted over. 5. Use NHS resources. NHS UK provides easily accessible guidance for parents to help manage winter illness at home. Don't miss the latest news from around Scotland and beyond. Sign up to our daily newsletter.